distinguished organizers of the Asia Pacific Sustainability Conference and Awards, honored guests, esteemed representative of international organizations and academic institutions, ladies and gentlemen, good day to all of you. Well, allow me to begin by expressing my sincere gratitude to organizers of this conference for the invitation and for creating such a valuable platform where institutions, experts, and change makers from across the Asia Pacific region can come together to exchange ideas and share experiences and build partnership in the pursuit of sustainable development. Well, it's truly honor to stand before such a distinguished audience today. Well, my name is Izzatbek Rejapov, and I have the privilege of serving as Vice Rector for International Cooperations at MUN University, Uzbekistan. On behalf of our university's leadership, faculty, and international partners, I would like to thank the conference committee and all of our fellow delegates for the opportunity to present a project that is very close to our hearts one that reflects our university's commitment to turning scientific research into real life-changing outcomes for the people we serve. Before I move into the details, I would like to also acknowledge our key partners who have made this possible. Mara University of Technology and World Health Organizations. Their expertise and dedication, shared vision have been instrumental shaping the project I'm about to present. With your kind permission, I will now begin the presentation. So the project I'm honored to present today is titled Ona Parvoze, which translates to Wings of Compassion. It is an international scientific and practical program dedicated to strengthening the wealth and health of women and children, preventing congenital defects and ensuring integration in Uzbekistan, with a particular focus on the Aral Sea region. And the project brings together the three key partners: MUN University, Marmara University of Technology, and the World Health Organization. So let me explain why this project is so urgently needed. Therefore, like four interconnected challenges we are addressing. First is the ecological crisis of RLC, the salt and dust particles in deteriorating drinking water quality and nutritional problems are contributing to rise to both congenital and acquired diseases. Secondly, the burden of congenital defects, heart conditions, whether visual impairments, and other deformities are treatable with modern medicine, yet high costs and shortage of specialists remain significant barrier for our populations. And thirdly, the social consequence, like when the conditions go untreated, they limit the access to education and employment. And that's why disability level rise and poverty is passed down through generations. And fourthly, the particular vulnerability of women and people with diseases who are often excluded from quality medical service, professional development, and social life, which hinders the full realization of their gender equality. Our main strategic objective is to improve the health of women and children living in Uzbekistan and RLC region to ensure the early detection and effective treatment of congenital and acquired diseases, to expand access to highly technology and medical care, and to ensure the full integration of these patients into the social and economic life. We pursue this object through three complementary pillars like medical care, through diagnostics, surgical and rehabilitation services, social integration through mechanisms for education, vocational training and deployment, and system capacity by strengthening the local medical institutions and specialists. To achieve this objective, we have defined 8 core tasks. We aim to identify girls and women with heart disease and provide them with specialized medical care, to organize diagnostic and surgical services for visually impaired women and children, to address these problems through reconstructive surgery, and to organize free or subsidized treatment for low-income families. In parallel, we will introduce preventive screening programs for women and children's health, upgrade the qualifications of local medical personnel and faculty to international standards. Well, in fact, it is also established a post-operative rehabilitation and psychological support system, and as this assists to treat patients, and it also assists to treated patients in actually reintegrating into the society and education. Well, w- target groups. When it comes to target group, this actual project is actually designed to serve 8 specific target groups. Women from low-income families, the population living in the RLC region, and girls and children with congenital heart defects, and women and children with limited eyesight, women and children with maxillofacial deformities, mothers with disabilities, university faculty and medical specialists who will build long-term capacity, and indirectly the families and the communities surrounding all of these individuals. That's what this target group is. So, and implementation, we have a 4-stage implementation module. Like stage one covers diagnostics and screening. It means regional medical examinations and electronic patient database and identification of high-risk groups. The stage two is dedicated to surgery and treatment, which means a total of 300 high technology operations spanning cardiac, like other surgeries. And stage three focuses on rehabilitation, which includes post-operative follow-ups, psychological support, and social adaptation to programs. And the stage four, last stage, builds workforce capacity, training with international experts and upskilling like our local specialists. So, allow me to elaborate on each stage in turn. Let's dive into them one by one. Stage one, diagnostics and screening. Begins with comprehensive original medical examinations organized in Karakalpakstan, Horizm region, and areas bordering the RLC, involving cardiologists and plastic surgeons and other specialists. All findings are recorded in a unified electronic patient database, capturing each patient's diagnosis, test results, and treatment plan, which will continue to serve local healthcare institutions long after the project concludes. So it also helps to the local authorities as well. So this process allows us to identify the high-risk patients and develop individual treatments and rehabilitation programs for them. And the next stage is surgery and treatment. So, excuse me. So, stage two is a project's actually main component, delivering high technology medical care to identified patients. We plan to carry out 3 cardiac surgery operations, and we planning to carry out 100 other operations addressing cataracts, conventional eye defects, and other treatable vision problems. And we also have a plan to do 100 reconstructive maxillofacial operations for cleft lip and a palate and trauma-related deformities. In total, uh, This stage delivers about 300 high technology surgical procedure. Stage three and four. Let's talk about the stage three. So, rehabilitation. Actually, it actually ensures that every patient receives post-operative medical follow-up to prevent the complications and secure a full recovery. While individuals group psychological counseling and social adaptation programs also delivered in this. And running in parallel, stage four workforce capacity delivers a practical seminars and master classes with leading international experts, and also continues to educate for faculty members and in residents and practicing physicians as well. And the transfers of modern diagnostics and treatment technologies with hands-on training for our specialists. Oh, sorry, my bad. So, I hope you can see it. So, expected results, what we are expecting from this. By the completion of this project, we are expect almost 300 patients, more than 300 patients to have received highly qualified surgical care, which is also a very good result, I think, we think, because a measurable reduction in the level of completions leading to disability and substantial improvements in the quality and reach of regional medical service. So beyond this, we have other plans, so, such as the quality of life of women and children will improve significantly because opening wider opportunities for them for their independent living, education, and employment. The professional capacity of our local specialists also will be strengthened through the international expertise, experience exchange groups, and indicators of gender equalities and social inclusion will also improve. And the infrastructure and partnership network we built through this project will also continue to deliver impact for years to come because, as I mentioned, we are planning to train local physicians and local medical staff as well. So that will also, in fact, provide secure and quality service to the local patients. And now we have about financial planning. Well, financial planning, so it's like turning out like the total project budget is estimated about at approximately 8,375,000 US dollars, equivalent to roughly about 96.9 billion Uzbek sum. This is like allocated across three categories such as equipment and infrastructure at approximately 7.2 million US dollars and representing the largest share of the budget. Surgeries and medical service at approximately like 783,000 US dollars, and additional costs like approximately $391,000. Well, when it comes to the financial planning, if you look closely at the medical services company based on the current prices and international standards, the average cost per person is about approximately like 28 million soon for cardiac surgery and 33 million soon for other surgeries also. So each figure covers like diagnostics, surgical costs, and hospitalization and patient care and medications and rehabilitation as well. The total estimated cost of medical service for all 300 surgeries is approximately 9.1 billion Uzbek sun. So financial plan, the equipment and infrastructure component totaling about 7.2 million US dollars. that includes procurement of Da Vinci surgical system at approximately $2.8 million. The projects like key innovative systems like enables remote and high technology surgery alongside other equipments and procedures. Like how we fund this program, the source of funding. This project is actually designed to be financed through the diversified and sustainable funding module. Our core international partners include World Health Organization, and our main partner for equipment, medicine, and monetary system, UNICEF, and supporting children's health and early detection of congenital diseases like UNFPA, and we have supporting women's health and reproductive health and gender equality and Islamic Development Bank, and as an investment partner for medical infrastructure and equipment, these are complemented by international donor organizations providing grant funding and for healthcare and disability reduction. State and non-state grants through ministries, funds, and universities, and sponsorship funds from local international businesses and charitable organizations. Together, these sources are harnessed to ensure long-term financial stability. So it will provide the funding for this program. So project partners. Let me now introduce our three key implementing partners in more detail. MUN University serves as a scientific and social partner. We conduct scientific research on women's and children's health, engage our students and young researchers directly in screening and research, partly cover the treatment costs for low-income families. And we have Mara University of Technology serves as our clinical and expert partner, organizing complex operations and with leading professors and clinicals, engaging international experts for consulting on complex cases and organizing qualification programs for local physicians. And we have World Health Organization serves as our technical and financial partner, providing technical cooperation for modern medical equipment, like financing medicine and consumable materials, and providing methodological support for planning and monitoring this program. And now we have sustainability strategy, which is for long-term impact. Well, sustainability is like at the core of this project design. It rests on six pillars: the medical infrastructure and surgical instruments we produce, procure, will continue to be used by the local institutions like long after. The specialists we train, the electronic monitoring and patients database, partnership network that we built will also keep providing service and impact to the people of targeted groups. And patients whose health is restored will also gain access to education and employment, reducing risk of poverty. And throughout all of this, we have the project strengthens and the social participation of women, girls, and people with disabilities, which will greatly increase their participation in the daily life of our society. And we have actually reviewed all of them together. We have a saying that we have our logo, should I say motto, something, together for a healthy generation. This is the spirit in which Imam University and Mari University of Technology and WHO joined forces on the Ona Parvazı project. We believe that through international cooperation and scientific rigor and genuine compassion, we can transform the lives of thousands of women and children in Uzbekistan and RLC region. So, distinguished guests, this project represents more than a set of medical interventions. It represents our university's conviction that sustainable development must reach the most vulnerable members of our society, that health and education and dignity are inseparable from one another. On the behalf of MUN University, I would like to once again thank the organizers of Asia Pacific Sustainability Conference and award for this opportunity. And I extend an open invitation to all of you, the institutions, donors, experts alike, to join us as partners in bringing this project to life. We welcome any questions. We look forward to building meaningful partnership with all of you. Once again, I would like to thank you very much for your attention. Thank you.